I'll quickly try to look at the temporal bones. And okay, temporal bone is just like we have looked at the zygomatic bone, so the bone at the back. Okay, sorry, this is the zygomatic bone. Sorry, this is the parietal. So the temporal one is this one at the back here. Okay, having the famous mastoid process on it. So let's quickly look at another image. This is the best way to learn anatomy is by visualizing. Have the zygomatic bone, and we also have the temporal bone here. This is temporal bone with all its parts. So we said that they're actually paired cranial bones. Why? Because you have one on this side, you have the other one on the other side. So they are located on the lateral skull between the sphenoid and the occipital bones. They are actually irregular bones, and they are part of the overall cranial skeleton. So they have different parts. We have the squamous part. Okay, this is the best image for that. We have the squamous part. We have the tympanic part. We have the mastoid process. Okay, this is the mastoid process. You also have the styloid process. You also have the Petrous part. Then we also have the zygomatic part. So Petrous part is a thick pyramid shaped portion housing the inner ear structures. Seen it? Okay, so that's what we got. So articulations above, they will join with okay, with the parietal bone. Okay, then at the back they join with the occipital bone. At the front they join with the sphenoid bone. I seen it? Sphenoid. Okay, then anteriorly also the zygomatic process. Function is to protect the temporal lobes of the brain, also to house the middle and the inner ear structures, also to provide attachment for muscles that you use in chewing, and also muscles of the neck, so that you can be able to move your neck the way you want, and also forms part of the cranial base and the zygomatic arch. It could be affected by mastoiditis, which will affect the mastoid process. You could have the temporal bone fractures, which is fractures of this bone at any point. Then also the styloid process could be elongated too much, which is one condition which is known as the eagle syndrome. We get to talk about all these things in the next lectures to come.